Dequervains tenosynovitis is a painful irritation of some of your thumb tendons where they cross the wrist. Anyone can get Dequervains, but it is most common in mothers of young babies and in older people doing repetitive tasks. The result? Wrist pain near the base of your thumb, especially during gripping and picking up. There are 4 ways that the team at Flex Physiotherapy test for Dequervains tenosynovitis. In Dequervains, the wrist will be sought to touch in a very specific location. This part of the wrist is called the first extensor compartment. If there is soreness in other areas, perhaps Dequervains is not the cause of your pain. Thumb extension should be tested in 3 ways: passive, active, and against resistance. In Dequervains, passive thumb extension is usually pain-free. If it is not, there may be a thumb or wrist joint problem. Active thumb extension usually brings on pain over the first extensor compartment. There may be decreased range of movement compared to the other thumb. When resistance is added by the therapist, thumb extension will usually become more painful again. Finkelsteins Test is the best known way of examining for Dequervains. Be aware that you are also stretching the superficial radial nerve and several joints. You may get a false positive. Ask the patient to fold the thumb across the palm and hold it with the fingers. Warn the patient to move slowly in case the next part is painful. Ask them to tilt their hand down towards the table. The test is positive if it brings on their pain, and they may also have decreased range of movement. The Watt test is a more recent addition to the range of tests available for Dequervains. It is extremely sensitive, few false negatives, and has a high positive predictive value of 0.95. First, ask the patient to bend the wrist into maximum comfortable flexion and hold the thumb out in a fully abducted position. Then, ask the patient to keep the thumb from moving and apply upward pressure to the thumb. If their pain is reproduced, the test is positive. Using these 4 tests, the team at Flex Physiotherapy can determine whether Dequervains tenosynovitis is the cause of your pain. If you feel you may have Dequervains tenosynovitis or have any other persistent pain troubles, contact the team here at Flex, who are always happy to help with your physiotherapy needs.